Welcome, everyone. Today, we're going to break down a really fundamental concept in pathology, one you absolutely have to master: pathological calcification. We're going to make this super clear and hopefully pretty memorable. All right, so here's our game plan. We'll kick things off by defining what this calcification thing even is. Then we'll dive deep into the two main types, dystrophic and metastatic. After that, we'll look at a really cool diagnostic clue called Psammoma bodies, and then we'll wrap it all up with a nice, clean summary. Let's get started. Okay, let's jump right in. What are we actually talking about when we say pathological calcification? Well, put simply, it's when the body starts laying down calcium salts in soft tissues where they just don't belong. So this is our core definition, but what does that mean in practice? Well, when you're looking at a histology slide, these calcium deposits are going to jump right at you. They don't stain pink like a lot of other things do. Nope, they grab onto that hematoxylin stain and show up as these coarse, kind of gritty-looking dark purple or blue clumps. It's a really distinct look. Now, listen up, because this is the most crucial concept to get right from the start. Pathological calcification isn't just one process. It happens through two completely different pathways. And here's the fundamental difference I want you to burn into your brain. In one, the problem is the tissue. In the other, the problem is the blood. That distinction right there, it's the key to understanding everything else we're going to cover today. First up, let's tackle dystrophic calcification. This is by far the more common type you're going to see both on pathology slides and out there in clinical practice. The key here, and I mean the key, is that the patient's blood calcium levels are perfectly normal. The problem is totally localized to a spot that's already been injured. Think of it this way. Dying cells, they just can't regulate their internal calcium anymore. Their damaged membranes become this perfect little starting point. We call it a nidus for calcification to begin. A nidus is just a little nest, a focus for the whole process kicks off. And from there, calcium salts from the fluid all around it can just start to precipitate and build up. And this list of examples really drives that point home. I mean, look at it. Every single condition here involves some kind of pre-existing tissue damage. You've got the caseous necrosis in TB, you've got the gunk and an atherosclerotic plaque that hardens arteries. All of these provide that nidus, that starting point. It's exactly what happens on aging or damaged heart valves, leading to really serious conditions like aortic stenosis. Okay, let's switch gears to our second type, and you'll see it's a completely different story. We're now talking about metastatic calcification. And just a quick heads up, the word metastatic here has nothing to do with cancer. It just means the calcium is depositing all over the place, far from where the actual problem started. So in this case, the tissues are completely innocent. They're perfectly healthy. The problem is systemic. It's in the blood. The blood is just super saturated with calcium. And when that concentration gets high enough, what happens? The calcium phosphate salts simply start to precipitate out and deposit in any tissue they can find. This leads to a widespread diffuse calcification process. So what could possibly cause your blood calcium to get that high? Well, here are the classic culprits you've got to know. The number one cause is hyperparathyroidism. Too much parathyroid hormone just pulling calcium right out of the bones. Chronic kidney disease is another huge one because when the kidneys fail, they can't get rid of phosphate. This leads to hyperphosphatemia, and those high phosphate levels then grab onto calcium, forming salts that just drop out of solution into the tissues. That mechanism is really important to understand. You know, what's really fascinating here is that even though the high calcium is everywhere, it doesn't just deposit randomly. It has its favorite spots. And there's a really neat biochemical reason for this. Think about it. The kidneys, the lungs, the stomach lining, they're all busy secreting acid. And that process leaves the tissue right around them just a little bit more alkaline than the rest of the body. It's this slight alkalinity that creates the perfect chemical environment for calcium salts to precipitate and settle down. Okay, time to talk about a very special, super high-yield form of dystrophic calcification that you really need to be able to recognize. They're called Psammoma bodies, and for a pathologist, finding one of these is a massive clue. The word Psammoma actually comes from the Greek word for sand, which kind of makes sense when you see them. Under the microscope, they're these beautiful little round structures. They've got these rings, almost like the rings of a tree trunk or layers of an onion. And what they are is just the progressive calcification of a tiny little cluster of dying cells. So why do we care so much about these tiny little spheres? Well, because seeing them down the microscope is a powerful, powerful diagnostic clue. If you find one, your brain should immediately go to this specific list of tumors. Finding a Psammoma body in a biopsy can be a huge pointer that helps you nail the diagnosis.
For your exams, you have got to know these associations. And luckily, the name itself gives you a fantastic mnemonic. Just think Psammoma. P is for papillary thyroid, S is for serous ovarian, and the two M's are for meningioma and mesothelioma. Psammoma. It's such an easy way to lock that information in.
So we've gone through the two main pathways. We've talked about a special example. Let's bring it all together now. We'll put it on a single high-yield summary slide to make sure these concepts are absolutely crystal clear.
Okay, this table right here is your money slide. This is your key takeaway. If you remember nothing else from this whole explainer, remember this. It's got everything in one place. Dystrophic, normal calcium, diseased tissue. Metastatic, high calcium, normal tissue. Seriously, pause the video here if you need to, and make sure you've got this down cold. So let's end by thinking about the patient, because our goal isn't just to spot these things under a microscope, right? It's to understand what they actually do. So think like a clinician. What happens when solid rock starts building up inside soft, functional tissue? Well, when it deposits in a heart valve, that valve gets stiff and you get stenosis. When it deposits all over the kidney, you can get renal failure. So always connect the pathology back to the patient and what it means for their body to function.